absolutely. So I think for a long time now we have, as a community, recognized that there is a link between heart disease and cancer, two of the most common causes of both mortality and morbidity in the United States, if not worldwide. And what we were realizing is our research group actually does a lot of work looking at risk factors related to heart disease, specifically heart failure. And we found, interestingly, that many of these patients were dying of non-cardiovascular related causes. And when we probed further, we found that actually they were dying of cancer causes. And so that was the initial spark and the initial reason that we undertook this study. And essentially we studied a large number of patients in the Framingham Heart Study, and we looked to identify the association of cardiovascular risk factors, cardiovascular risk scores, cardiac biomarkers, and then interim cardiovascular events with cancer. And we found that I think probably the three most important findings we found was, one, that there were specific risk factors that we've known to be related to heart disease that were in fact predictive of cancer. We also found that a specific cardiac biomarker called BNP, which is related to heart failure, was also associated with increased risk of cancer. And finally, probably the most interesting thing we discovered was that if you were to develop some sort of heart event, whether that was an MI or heart failure, whatever the case may be, that actually increased your odds of developing cancer by something like 7-fold, so pretty significant. You know, we spend a lot of time as cardiologists and as primary care physicians thinking about risk factors for heart disease. We've known for a long time that things like hypertension, diabetes, smoking, all definitely increase your risk of heart disease. And we actually use a risk score called the 10-year ASCVD risk score to help us categorize which patients are very high risk for developing heart disease in the next 10 years and who are maybe at lower risk. And what we discovered is that folks who have a greater than 20% risk of developing some sort of heart event based on their risk factor profile, we're actually at a 3-fold increased risk of developing cancer. So I think what's important now is that we've spent a lot of time thinking about trying to manage risk factors so that we could prevent future heart disease. But I think we now need to be thinking about these same patients and their cancer risk as well. Yes, I think cardio-oncology is this huge booming field. I think even at this meeting alone, there's so much discussion about the intersection between these two fields. Right at present, we study a lot about the cardiovascular effects of individuals who've been treated for cancer. So what are the downstream effects of receiving chemotherapy or radiation treatments, for instance? What are their cardiac effects? We're sort of flipping the question on its head and sort of saying, well, what if you have heart disease? What is your future risk of cancer? And we're only starting to begin to better understand that there is a link in that direction. And I think that we need to do a whole lot more work to really understand, is this link between heart disease and cancer because we share risk factors, because these two entities share risk factors, or is it that developing heart disease actually increases your risk of developing cancer for whatever reason?